Well, good morning, everyone. Welcome to TLC Academy in the new year, 2018. This morning we have a wonderful presentation that we're going to receive from Sharon McCarthy, one of our team members. The topic today is coping with and supporting someone through a mental health condition. So with that introduction, I'll have Sharon take over and lead us through some information about that.
Good morning. A lot of the information that I have is from NAMI, which is the National Alliance on Mental Illness. And this happens to be from the Vermont. It's located in Waterbury, Vermont, and I can give you some information at the end of the presentation so that you can research on your own as well. But today we're discussing mental health conditions, and mental illness is a condition that affects a person's thinking, feeling, or mood. Such conditions may affect someone's ability to relate to others and function each day. Each person will have a different experience, even people with the same diagnosis. Recovery, including meaningful roles in social life, school, and work, is possible, especially when you start treatment early and play a strong role in your own recovery process. A mental health condition isn't the result of one event. Research suggests multiple linking causes: genetics, environment, and lifestyle influence whether someone develops a mental health condition. A stressful job or home life makes some people more susceptible, as do traumatic life events like being the victim of a crime. Biochemical processes and circuits and basic brain structure may play a role too. Recovery and wellness. 1 in 5 adults experiences a mental health condition every year. 1 in 17 lives with a serious mental illness such as schizophrenia or bipolar disorder. In addition to a person directly experiencing a mental illness, family, friends, and communities are also affected. Half of mental health conditions begin by age 14, and 75% of mental health conditions develop by age 24. The normal personality and behavior changes of adolescence may mimic or mask symptoms of a mental health condition. Early engagement and support are crucial to improving outcomes and increasing the promise of recovery. ADHD, attention deficit hyperactivity disorder, is a developmental disorder where there are significant problems with attention, hyperactivity, or acting impulsively. Anxiety disorders. Everyone experiences anxiety sometimes, but when it becomes overwhelming and repeatedly impacts a person's life, it may be an anxiety disorder. Autism. Autism spectrum disorder is a developmental disorder that makes it difficult to socialize and communicate with others. Bipolar disorder causes dramatic highs and lows in a person's mood, energy, and ability to think clearly. Borderline personality disorder is characterized by severe, unstable mood swings, impulsivity and instability, poor self-image, and stormy relationships. Depression. Depression is more than just feeling sad or going through a rough patch. It's a serious mental health condition that requires understanding and treatment. Dissociative disorders. Dissociative disorders are a spectrum of disorders that affect a person's memory and self-perception. Early psychosis and psychosis. Psychosis is characterized as disruptions to a person's thoughts and perceptions that make it difficult for them to recognize what is real and what isn't. Eating disorders. When you become so preoccupied with food and weight issues that you find it hard to focus on other aspects of your life, it may be a sign of an eating disorder. Family members and caregivers. When a friend or family member develops a mental health condition, it's important to note that you're not alone. Many Americans have experienced caring for a person with mental illness. 1 in 25 Americans live with a serious mental health condition. Mental health professionals have effective treatments for most of these conditions. Yet in any given year, only 60% of people with a mental illness get mental health care. As a result, family members and caregivers often play a large role in helping and supporting them. Excuse me. Millions of people have experienced the thoughts and questions you might be having now. You may be trying to help a family member who doesn't have access to care or doesn't want help. Or you may want to learn how to support and encourage someone who has been hospitalized or experienced a similar mental health crisis. NAMI realizes that the challenges of mental illness do not only affect an individual's family members, but also friends, teachers, neighbors, co-workers, and others in the community. Here they use the term family member and caregiver interchangeably to refer to someone giving emotional, financial, or practical support to a person with a mental health condition. Whether you're providing a lot of assistance or very little, the information here can help you better understand the issues that you might face. Supporting recovery. When someone has a mental health condition, support from family can make a big difference. However, it may be hard for us as family members to know what approach is best. It's particularly difficult to balance showing support with caring for our own health and encouraging others to be responsible for their actions. Remember, you're in the process of learning. Helping a family member is difficult, even if you do everything right. No book, therapist, or website can tell you how to prepare for the situations that may arise. So true. It may help to think of this experience as a learning process. Every person with a mental health condition experiences it slightly differently. One person may fear losing a job, while another may be more worried about how relationships will change. If you ask questions and listen to the answers, you can learn about your family members' unique concerns. You can also acquire better skills for offering support as you learn what works well in your family and what doesn't. If you come from a family that's uncomfortable talking about mental illness or emotions, remember you have the ability to improve your communication. Similarly, even if you feel like you don't know how to offer encouragement right now, you can develop and improve through practice. Remember, however, support is not control. We can support and encourage our family members. We can't, however, make their treatment decisions for them. We should offer suggestions and input, but be ready to accept and support their decisions. They may not choose the treatment options that we would prefer, but acknowledging their right to decide, we create a respectful, healing environment within the family. We improve their immediate quality of life by treating them with dignity. We're also encouraging them to commit to their chosen course of action. The reality is that when we can only control our own actions, we have to learn to give the people around us the responsibility for decisions that only they can make. It's ultimately up to them to decide on their goals and strategies. You can encourage your family members, but you must let go of the feeling that you have to solve their problems for them. Remember, an illness is influencing your family members' behavior. Even when we know someone has a mental health condition, it can be hard to recognize his or her efforts to be well. Sometimes we wonder if a family member is trying to be difficult. We may find ourselves looking for something to blame. Should we blame our family member or the mental health condition itself? In general, we should try to give family the benefit of the doubt. Remember that no one chooses to experience these symptoms. Things you can do to be supportive. One of the most important ways to support a family member is to maintain our own mental health. The healthier we are, the more energy we have for problem solving and offering encouragement. We can then offer practical support such as the following. Learn as much as possible about mental health and your family member's condition. Knowledge gives you practical insight and understanding. Learn about available treatments, what therapies and medications can help. Do people with this condition typically spend time in residential treatment? What options are available for supportive housing or employment? Show interest in your family member's treatment plan. Doctors and other medical providers cannot talk to family members without a patient's permission. That can be very frustrating for the family. So ask your family member to arrange their permission. Talk to the medical team about what to expect from the treatment plan. In particular, ask about possible side effects of medication. Find out how to call the provider if you notice behavior or emotional changes you're concerned about. Encourage your family member to follow the treatment plan. This might mean offering transportation to therapy sessions or reminders to take medications as prescribed, because daily prodding about medication can easily insult or anger an adult. Handle this carefully. Talk to your family member about his or her preferences. Try to set up a simple system to reassure you that the treatment is continuing as planned, and to reassure them. Strive for an atmosphere of cooperation within the family. Cooperation means not just offering support, it also means communicating with everyone in the family and distributing responsibility equally. Don't try to spare family members from stress by leaving the caretaking to one individual. That can be overwhelming. Assign everyone in the household roles to play according to their abilities. Include your family member with the illness as well, making his or her responsibilities to the family clear. Listen carefully. Simply listening is one of the best ways to show your support. If your family member says hurtful things, it helps to listen for the emotion behind the words rather than focusing on the words themselves. Try to recognize and acknowledge the pain, anxiety, or confusion rather than getting into unnecessary arguments. Resume normal activities and routines. Don't let life revolve around your family member's mental health condition. Return to a regular routine within the family. Spend time together on activities unconnected to the illness, such as watching a movie, eating dinner out, or visiting a favorite park. Practice living life with mental health condition rather than struggling against mental health illness. Don't push too hard. At the same time, remember that it takes time to heal from an acute episode. Allow your family member to rest. Offer him or her opportunities to ease back into routine activities rather than requiring participation. A gentle approach encourages recuperation. Find support. Outside support and encouragement is critical for everyone in the family, not only the person with the mental health condition. Whatever your role in the family, stress is easier to handle when you regularly talk to people who understand your experience. That is so important. Peer-led support groups are available for people living with mental illnesses and also for their family members. Express your support out loud. Spoken encouragement can reduce stress levels. You don't need to say anything fancy. Practice a few simple, gentle statements like, "I'm sorry you feel bad and I want to help. It isn't your fault. It's an illness that can happen to anyone. Hang in there because you'll feel better down the road." Keep yourself and your family members safe. If there's a risk of violence, make safety a priority. Regarding physical or verbal abuse, set limits that you can keep. For instance, state that you will leave and call the police if your family member becomes physically violent. Discussing your plans for these situations ahead of time can make them more manageable. Prepare a crisis plan. That includes important phone numbers, such as the local crisis intervention team. Include your family member in the planning of this document. Make everyone in the family aware of what they should do in case of an emergency. Don't give up. A person with a mental health condition benefits enormously from having social support. Remind your family member that you're there to help and you're not giving up. When setbacks occur with one treatment strategy, look for alternative strategies. Try something new and encourage your family member not to give up, that a good life is possible. supporting a loved one with a psychological condition. So we will just reiterate a few of the things we've talked about. Listening. Listening is the most important thing you can do. Rather than pushing a loved one to open up about their illness, simply wait for them to feel confident enough to discuss with you. And when they do, make sure to simply listen. Sometimes words are too much in a situation like this. Sometimes we try to over-explain things. In combination with listening, holding someone when they are feeling down or are experiencing an episode is the best way to show your support and how much you care. We don't need to even say anything really, just holding them. Even on the worst of days, you must remain positive. Some days will be harder than others, but with the right treatment in combination with a strong support system, your loved one will get better over time. This is inherently a frustrating process. However, you must remain patient at all times. Often, those with mental illness will say hurtful things in the heat of the moment that they do not truly mean. It is up to you to remain calm and patient during the most difficult of times. Even if the answer is fine day after day, keep asking how they are. When they are ready to open up and discuss their feelings, they will. You just have to be patiently waiting while remaining persistent. Whenever possible, try to lighten up the mood and make for a pleasant experience. Even if they claim they do not want to leave the house, try to take them to do their favorite thing or indulge on their favorite food. Most importantly, be there. Your presence, patience, and persistence will pay off in the long run.
Thank you, Sharon.
You're very welcome. So I did want to share a little bit of, this is the information from the resource guidebook
Yes.
from NAMI. And they're located at 162 South Main Street, Waterbury, Vermont.
Okay.
In case anyone wants to seek more information and do some research. And there's a phone number. Should I share that?
Yes, please.
So the phone number for NAMI Vermont in Waterbury is 802-244-1396. Now they do have weekly support meetings for the family members and also for the person experiencing a mental health condition. They are separate. There are meetings for the person that has the condition. There's also meetings for the families, separate meetings. And they also have a training session, which is 10 to 12 weeks, and it was quite a while ago that my husband and I took part in that ourselves for family members. So I'm not quite sure what the cost is or how they run, but it's enormously,
Helpful.
absolutely very productive and helpful, and I can't say enough about if someone can do that, try to take the training.
Would you be able to please repeat the number one more time for NAMI?
The phone number?
Yeah, the phone number, just so if they didn't get a chance to write it down, the
Yes.
audience can do so.
Again, the phone number for NAMI Vermont is 802-244-1396, and that's located in Waterbury, Vermont.
Great, thank you.
You're welcome.
Before we close, I had a couple of questions that popped in my mind, and perhaps even a comment or two. I was really struck by the statistic you quoted of half of mental health conditions begin by the age of 14.
Interesting, isn't
And
it?
that 75% of mental health conditions develop by age 24.
Yeah,
I mean, that leaves me feeling like the mental health problems in our world are on each end of our lives.
Of the
I mean, it's
spectrum.
when you're kids and then when you're old. And it's not to say that people in between don't have their issues and have some problems, but the core of these problems begin really young, which is much younger than I expected to hear.
right, and I think the point of that and what they're finding is that a lot of, there's red flags
Yeah.
when children are growing up, and sometimes we miss them.
I
We think
see.
it's just part of teenage angst or whatever,
Yes.
whether it's a male or a female.
Yes.
Especially with males, you know, they can,
Yeah.
not necessarily, but I mean that often seems to be the case because boys tend to be very, they go through a stage of being aggressive and, you know, moody, and although women, you know, girls do too, but So that statistic is very interesting, isn't it?
It is, because like you said, sometimes those things are attributed to just normal development, and when they're really not, there could be a really serious underlying concern for the person.
But sometimes they can be too, so
Yeah.
it's,
Yeah.
you know, there's usually, like I say, with serious mental health conditions,
Right.
from what I understand, there really are red flags that we miss.
Can you define for the audience the term developmental disorder? What does that mean?
Developmental disorder.
Right,
let's
like
see.
under autism, for example. An autistic
Well, that's
person
a spectrum.
has a developmental disorder.
Right, and there's a whole spectrum under that. Let's see what it says here, as far as so that I am explaining it. It's a developmental disorder that makes it difficult to socialize and communicate with others. But there is a whole spectrum of that. You know.
No, so the term
there
developmental
are
means
different
that
levels.
that someone is born with this and it evolves in their life?
Well, I think, you know, a lot of them are, you know, they say that a lot of things have to do with, it can be genetic, but it
Okay.
also can be traumatic events, any of these
Right, so,
disorders.
yeah, it's a combination of the
Yes,
environment and the
environment
genetics.
and
Okay.
genetics. And
That makes sense.
Some people experience the same things and don't develop these disorders.
Yes,
So it depends on genetics, as we were saying,
Yeah,
and also
yeah.
the environment makes a
Yeah.
big difference
Right.
in a lot of things, whether it exacerbates or not.
Okay, very
I
good.
think.
That helps to clarify that a little bit. Can you help me to define the difference between psychosis and delirium? My understanding with psychosis is it's the whole thought process of a person is disrupted. Their perceptions are, they're seeing things that aren't real. They're feeling things that aren't real. How does that differ from a person who is delirious?
I think it's probably very similar.
You think it is?
I do.
Yeah.
I think it's pretty serious, you know, delirious. Somebody can be delirious from medications or, right?
Right, that's true. So some of this may not, psychosis may
or
not result.
addictions.
Right. So the cause of psychosis might be different than delirium.
Right, psychosis is a crisis.
Yes. Okay,
Generally.
that's a good way to describe it.
Yeah.
Crisis
A
versus
person-
delirium.
Yeah, person is hitting a crisis.
Yeah.
And one of the things they're finding is that, you know, addictions, alcohol or marijuana, they're finding, which is something that a lot of people weren't aware of before, that the marijuana that's on the street today, or even sold legally, the THC levels are very, very toxic and very high, and it's causing psychosis. A lot of people are experiencing psychotic episodes,
Yeah.
and getting very sick because of the THC levels.
Right,
So
changing their
that's
brain, basically.
absolutely, but that's why we need legalization, but oversight
With control.
with control.
Yeah.
And it's the same thing when there was prohibition with alcohol. You know,
Yes.
that didn't work.
Yeah.
So it's like, even though it's legal, they still don't have the controls in place.
Right,
They
which they
have-
do with alcohol, because
Which
they tell
do
you
with
how much
alcohol
percent
now,
alcohol
because they
it is.
realize, exactly. And so even, you know, in California or wherever it's legal, they're finding the THC levels are so high,
Right.
and that's not regulated,
Yeah.
and they're not aware, and the stuff that people are getting on the street is making them very, very sick. So that's why legalization maybe is a good idea. I mean, that's my opinion.
Yeah,
But oversight.
yeah. Very
And
good.
a lot of people aren't aware. They think marijuana is so innocent. But, so, yeah, people can experience psychosis and psychotic episodes from a lot of different things.
Another related question concerning family members and caregivers. If only 60% of people with mental illness get mental health care, obviously one reason for that would be they choose not to take it.
They're resistant.
They're resistant. Can you offer us some other examples of obstacles to mental health care?
There's a lot of obstacles to mental health care because, one, the families can't get information if somebody does. If you're a family member trying to get someone help with a mental illness,
Yes.
you have you have nowhere that you can go because of the HIPAA laws.
Yeah.
They will
Which
not.
is why you mentioned in your presentation in part that we have to get permission from the person, and
Yes.
if they're too sick to give you the permission, then you can't do anything?
Or resistant.
Wow.
You know, some people with a mental health condition are resistant. They don't
Yeah.
want the family member involved, but yet you're the very person there trying to be supportive of them.
Okay.
So it's a real dilemma. You know, those are things maybe that we need to change as well when a family member is trying to help.
Hmm.
It's very, very hard to try to get answers.
So,
get
so,
any
so
kind
there's the control over confidentiality that is
Yes.
somewhat of an obstacle.
Yes.
There's the person's personal choice not to receive
Yes.
care. Are there any others that stand out for you?
All of that. I mean, it's impossible, you know, today for a family member to try to, because you're trying to sit down and you're trying to talk to the family member and try to reason with them, but you can't reason with them when they're in a crisis or when they have a mental health condition.
Right.
You're seeing things that they're not.
Yeah.
And sometimes they don't think that they have a problem. Often they don't think they have a problem until they really crash. So trying to discuss it with the family member is very difficult. And I know in our situation, we did a lot of research on our own. The person was very resistant, so it wasn't something that worked initially early on.
I see.
But we had to do what we could to understand what was happening, and that was through NAMI.
Yeah.
And a lot of the information that they have, and reading up on the conditions. And again, you cannot get information from a doctor unless they'll sign a form letting you be privy to what's happening with them. So often the family member's wondering, what do they have? I know they're sick, I know they're not well, but what do they have?
Yeah.
So you're like in this, it's just
Yeah, complicated.
very complicated, and you're in this wave of up and down of not knowing what you're dealing with, and so.
It also,
overall-
in my experience, it's also been an issue of the availability of services to help someone with a mental illness. So
Yeah.
we, as a society, we have grown the availability, but we're a long way from reaching a point where we have more opportunities than not for people. And as we get this older population.
You
that's-
think we have more opportunities
No,
than not?
well, we have, no, what I'm saying is I think we have more than we did, but we still don't have enough. That's a better way to
Exactly.
express
Yes.
myself.
Yes,
And
I
as
agree.
we get as we get this blooming population of elders
Mm-hmm.
who are developing dementia and other types of psychiatric problems,
Mm-hmm.
or combinations of all of those things, our system for managing psychiatric and mental health issues is gonna get even weaker because we'll have more people to deal with and not enough services to deal with it.
It's
So-
true, and sometimes people are over-medicated and they react to medications sometimes cause emotional instability and further problems.
Right.
So that's a very, that's something that people have to navigate as well. You know, all meds don't work for all.
That's true.
And sometimes the side effects are worse than the condition.
Yeah.
You know, you hear that at the NAMI meetings a lot.
Yeah, yeah.
So that's another obstacle. Yeah.
Is the treatments themselves can be hurtful, or not hurtful, but complicated. Yeah.
Well, and holistic sometimes is, you know, if one can go that way. I think it's important when someone's dealing with a psychotic episode or they're in a crisis. Sometimes we need meds to get through that. The people need, someone who's dealing with that needs medication for a stopover. But there are holistic ways also of looking into recovery from mental illness.
Okay.
And I think I've mentioned this before. Finland has a model of recovery where they do holistic and they have a 90% success rate versus this country, which has less than 20%. Whether
That's quite a difference.
whether it's addiction, alcoholism, drugs, brain disorders, whatever. They really, but what they do is it's a treatment, and it isn't just for 60 days or 30 days. It's long term. At least 6 months to a year, where they live in a facility and they participate in their own recovery. They participate in helping at the
Others.
facility, helping others. So there's peer support and a lot of encouragement. And again, being holistic. You know, diet's very important, and not always having so many medications in your body to have to. But it's maybe something that we should take a page out of their book and look at.
Yeah, I would say so, if it's that successful.
Yeah.
Another point of information you offered us was that sometimes it's hard to recognize when a person with mental illness is making an effort to be well.
Yeah.
Could you tell us again from your own knowledge and experience, what would be some examples of how we would know that someone was making an effort to be well?
When they're trying to be independent, when
Okay.
they're trying to do the right thing, you know, and sometimes what we think is doing the right thing is not what they're doing,
Right.
because we think they should be doing more. But it's really hard to acknowledge when someone is trying hard at recovery. If we forget how hard it is to put one foot in front of the other when your body's not working correctly and your mind is just like a pinball machine going into tilt.
Mm-hmm.
It's very hard for us to recognize that unless we ourselves have experienced it,
Mm-hmm.
or unless we get educated
Mm-hmm.
and know. You know, it's a real struggle when someone is not thinking clear.
Mm-hmm.
It really is a struggle. And
Sure.
they're very defensive, very sensitive, and take everything personally. So every little comment, every little nuance, every little facial expression is taken so personally. And we need to be cognizant and aware of that, I think, when we're around somebody like that.
Mm-hmm.
And that's hard to do.
It is,
I mean,
on
it is
an ongoing basis,
on
yes.
an ongoing basis. You
Yeah.
may be able to do it for a while because you're aware of it, you're in the moment,
Mhm.
but life happens.
Right.
And we have to take care of business and lead our own lives too. And so that's why it can be so wearing on the family members, because you have to almost be on all the time.
So again, coupled with what you just said, if I'm with someone who is experiencing mental illness and I live with them, and I see that they are taking their medicine regularly, they're trying to put that foot in one in front of the other and just going forward in a positive way is with their whatever capacity they're able to have at that time. Maybe the tone and the content of their conversation and communication with me would be another feature to look for to see how that plays out. So those would be some of the signs we would see as efforts that they're making to do the right thing.
Yes, and I also think our tone is crucial.
Our
what? Tone.
Our tone, our personal tone to
How
them.
we
Yeah.
how we speak.
To them.
We may be
Yeah.
saying something positive, but our body language and our tone is saying something
Uh-huh,
entirely
yeah.
different. And they're very sensitive to that.
Mm-hmm.
Someone I have been told over and over many times through a lot of these meetings that we went to early on, that is something that's just crucial, you know.
Yeah, we have to
That
be
we
alert
forget
to
that.
ourselves as much to
Yeah.
ourselves as we are to the other person that we
Well, but
we
you
love.
hear it a lot from everyone, all the family members.
Yeah.
I mean, we're human.
Yeah.
It's just, you know, like I say, life happens and we have to live our life too. And so
Right.
it's really hard to always be focused on, you know, how we're speaking, what we're doing. I mean, we should do that anyway in life, I guess, but it's not always in the forefront.
Right.
And someone who has a mental health illness
Mm-hmm.
they can be tipped over very easily by how we respond. That's why we need support. And we need to be reminded of what's really going on with this family member. At a lot of the meetings, you see a lot of families, their adult children are 30, 40, 50, and they've been caregivers all that time,
Wow.
trying to help them through this process or this situation. That's why, as independent as we can get them to be, with oversight, you know, the better off they are. Because I think a lot of times, the more dependent someone is on you, that doesn't help their self-esteem. And they talk about that in NAMI, about how important it is to acknowledge that they're an adult, if they are
Yeah.
older.
Yeah.
They're an adult, they need to be considered in these decisions. We need to not treat them like a child. And that's, sometimes you get caught up in treating someone with kid gloves because they do have a mental illness, yet they're an adult. So that's something to watch for too, because that can be very offensive to someone.
Right.
If we think about that, we wouldn't like that, right?
No, of course not.
And it's very hard to rationalize, you know. to deal rationally with somebody who's experiencing mental illness, it's very difficult, which is why
Right. They're not thinking the way we are.
they're not thinking the way we are at all.
Sharon, speaking of children, the child notion, how involved should children be in terms of helping someone in their family who's mentally ill? I mean, obviously, I'm not talking about little children who are 4 or 5 years old who are, don't have a sense of themselves yet, or they have a different sense of themselves. But I guess I'm looking just for a global response as to how do children in a family fit into the recovery of someone with mental illness.
I think the only way I can address that is to say that there's a lot of dysfunction that happens and goes on in families, and there's a lot of cover-up, right?
Yes.
I mean, when you're dealing with a lot of these conditions, they don't just happen.
Mm-hmm.
There is a lot of family dynamics that play a part.
Yes.
Because you've always, from the time they were very young, you've always been trying to maintain or understand or deal with.
Mm-hmm.
And then you go through this phases perhaps of tough love, because you think they're acting out, you think they're being difficult. So that doesn't work. You find out, well, this isn't working with this person. Then you find out, because there's a mental illness here.
Mm-hmm.
So when we often try to cover up and not really speak honestly about what is happening with a family member, and I don't think that helps. We do that with a lot of things in dysfunctional environments or families, right?
Mm-hmm.
We're not honest.
Right.
We are in denial.
Mm-hmm.
We don't talk about. So always best to handle things head on, to be honest and open, I would think.
Mm-hmm.
So when you're talking about children, you're not talking about young children.
Not
You're talking
necessarily.
about someone, what age?
Well, let's say someone who's 7 or 8 or 9 years old.
Kids know.
Yeah.
Kids,
I mean, emotionally, they certainly know. That I'm aware of.
Children know when there's something that's not right. And when we try to cover it up, a lot of us have had that experience with alcoholic parents, right? When we try, or our spouses or whatever, when we try to cover and not let the children become aware of what's going on, doesn't it messes with their emotions.
It does, because they get conflicted ideas.
They get conflicted.
They know something's wrong, but they're being told there's nothing wrong, which is so contradictory.
Always best to be honest. You hear that at the meetings a lot, at NAMI meetings.
Yeah.
Honesty is always best.
Right.
To deal honest with your family member, to deal honestly with yourself, and to deal honestly with what's happening in your life.
Right.
Not to try to cover it up and make excuses, or because there's too much. Eventually, it always gets found out anyway, and people get very confused and very sick when they don't know truth. Own your own truth.
And I really agree with that. And I also was thinking, as you were speaking, that we can't assume just because someone has a mental illness that they're automatically dangerous or that they're going to hurt someone overtly.
That's true.
So the notion of, oh my goodness, we can't allow these children to be around this person because they have a mental illness is really kind of foolish. Because, like you said, the children are there, they see what's going on. If they're not included in the recovery process, the understanding that this can be helped, this can be changed, then they go on through life not having the knowledge to know how to deal with something like this, even as they get to be adults. So,
very true, and oftentimes conflict can be prevented by not escalating situations. Where, when there is violence and danger, unless somebody's totally delusional or, like you said before, psychotic. And even schizophrenics, they've done studies where they're less inclined to be, people think if someone's schizophrenic, they're violent. And they have done studies where most people who are dealing with schizophrenia are not violent.
Exactly.
So,
My point exactly. That,
and
they're not everybody is a threat.
Not everyone is a threat.
To others.
However, that brings me to another point, and we can maybe do another presentation on this, the stigma of mental illness, and we can talk about that in the future.
The schism.
How to eradicate the stigma
Stigma.
of mental illness.
Yes. Very
Because
good.
that's something that's important as a society, and I'm glad that you asked that question because it is something that needs to be addressed, and maybe we can talk about that in a future presentation.
Sharon, I would welcome that opportunity to hear that in the
Okay.
future presentation, and thank you so much for today's presentation and the conversation we've had at the closure of it. I hope this will be informative to our audience, and look forward to having you return to us again in the future.
Thank you.